Hi there, everybody. Sorry about the late start. I'm Beth Ennis, and I just wanted to do a little Facebook Live here. I am going to talk today about sourcing herbal medicines in veterinary medicine. Let me see if I can get this a little bit less washed out. There we go. This is a common question that I receive is how to pick a good herbal medicine, and there's a lot that goes into it. So I thought it would be a good topic for us to discuss today. I'm also going to give a short update on kind of the state of the union at Sleepy Dog these days in terms of curbside protocols and all that jazz at the end, too. There are my children trying to get my dogs quieter. All right, so the first question when we talk about sourcing herbal medicines are, what are herbals? Herbals is kind of herbs are used as a varied description for a number of different things that may or may not truly be herbal medicine. So it's often used to describe things like Chinese herbal medicine. It's often used to describe things like Western herbal medicines, Western being more European or America in the Americas, or also Ayurvedic herbal medicine, and those are coming from the area of India and surrounds. Often herbal medicines can also be described or the term herb can be used when people are really trying to describe homeopathic medicine, which is actually quite different than herbal medicine. Herbal medicine uses plants in order to come up with combinations that will help medicinally help solve problems. Homeopathics is more using the essences of a plant or item in nature that you take let's say it's a plant, and put it into a solution, and then you dilute the solution out many, many times. So the essence or the energy of that plant or compound is infused in the solution, but there's actually no amount of the compound that we started with. So it's very different, but they're often grouped together in that way. There's also nutraceuticals, which is when a compound in nature, like let's say something like milk thistle, is broken down into its active ingredient and put into a vehicle to get into a person or a pet. And so that is something that can be really helpful as well, but isn't technically classified as an herbal necessarily, though herbals can often be a nutraceutical. So kind of confusing there. And then there's also blends. So there's a lot of different companies that have blends. They might have some herbal, some of it might be originating from a Chinese herbal medicine. Sometimes they'll add it with something Western, and sometimes they'll add nutraceuticals as well. So it can be different blends. So there's a whole lot of different things out there. One of the things that people often hope to get from herbal medicine is that it is safe. And so a lot of people think that if it is herbal, it must be safe. And I would say that that is not always the case, and something that I worry about a lot. So depending on how it's used, where it comes from, depends on whether it is something that is truly safe or not. So the first thing is, who recommended it? So if it was recommended by your veterinary team, then it is most likely that it is something that is appropriate for your animal. If it is something that's recommended by friend or family, or comes to you through online research, then that may or may not be appropriate. It just depends on what's going on with your pet. The other thing that can change and influence safety is what brand it is. So the herbal industry is not regulated very well at all. So most herbal medicines are under the guise of foods, and so they have different regulations than drugs would have. So for me, it's very helpful that most of the companies that I work with really treat their processes or manufacturing processes as if they were under FDA guidelines, which hopefully at some point we will have herbal medicines under FDA guidelines so that we can have some universality to it. But right now that's not necessarily the case. So we want to find brands that have good manufacturing processes and also that are sustainably and ethically sourced. And so that's really important. And also, we'll go into more of that. But that also is reflected by who is coming up with the formulas. The other thing that can influence the safety of herbal medicines is that there may be that your pet has underlying medical conditions. So if there is something that is going on in your pet, and some herbs may be helpful, some may be actually harmful. So it's important to work with someone to make sure that we're not doing anything harmful. The other thing that comes into play a lot is that there can be other medicines that your pet is taking, other supplements, and they can work together really well, or they can work against each other. Sometimes they can actually even potentiate each other. So sometimes you want that, meaning that the two supplements on their own does this much and this much for the pet, but then combined does this much. And so that's good in certain senses, but with some things you might want to watch out for that, because that might mean that a medicine that your pet is taking for a seizure would be even more powerful when given this herb. And so we want to be really careful, because we might need to reduce doses. So just some like common things that we want to watch out for. Another thing that I think often gets overlooked is whenever we put animals on herbal supplements, at least at Sleepy Dog, we always want to do very careful monitoring. So because an herbal supplement is a good fit originally when we put them on it, does not mean that it will be a good fit forever. So we want to do careful monitoring. So it matters, what is the condition being treated? Is it something that has showed up in blood work? Is it something that has showed up on some kind of imaging like an x-ray or an MRI? Is it something that has showed up with symptoms? So we don't know if it's helping unless we know what we're monitoring. So those things are all very important. Usually I tell my clients that we're monitoring for anything that their pet came in for. So if your pet comes in for a soft stool problem, then we're going to know best if something is helping by if that stool changes. When you have someone who is a true herbalist, they're going to look at things that are even side effects or changes in the body that may not be something that we are looking for, is going to tell us more about the underlying symptom. So it's why we have to be really careful about working together and communicating really well, because all the information makes a difference. So if it is something that we are monitoring with lab work or diagnostics, we're going to come up with a plan for how we are going to be evaluating. Are we going to check blood work again in a month? Are we going to check it again in 2 months? How are we going to do this? There's also many side effects that are a result of supplements. Whenever I read anything that says that this has no side effects, I always am instantly suspicious, because I have yet to see that be the case. So the side effects for herbal medicines are often gastrointestinal. So maybe a change in appetite, maybe a change in stool, change in frequency of stool or consistency of stool, maybe some vomiting, maybe some indications of nausea like licking of the lips or over grooming, things like that. So lots of things to look for there. If there is some kind of allergic reaction, it is not uncommon for us to see skin changes too. So it's not an allergic reaction necessarily that requires a hospital visit, but maybe some chewing of the feet, or scratching at the ears, or more ear infections. And that could be that there is some ingredient in that supplement that is causing a low-grade allergic reaction. And that's something that we don't want to have, and that's not a good fit for the pet. The other thing is energy changes. So a lot of times my clients that I see are, they often second guess themselves when they think like, oh, she is more energetic, or oh, she's a little bit less energetic. And trust yourself when you see these things, because you know best as a pet owner if energy levels are changing. And of course, there's many different things that go into that, but it is definitely something to watch for and to note and to trust yourself when you see that. So the other thing is that can impact herbal medicine is the duration of our treatment. So this can depend on the condition that we're treating. So some things are fast and furious and we don't need the herbal supplement long term. Some things are much more long and maybe the pet will be on that supplement for the rest of their life. The duration of the treatment is going to revolve around those monitoring parameters. That is where you want to involve your veterinary team to make sure that everyone is in communication, so we know when is the best time to remove the herb from the regime of the pet. It also can make a difference, the cost and the convenience of the medicine. Some herbal medicines are really costly and it's not really reasonable to use that long term. Other times that is what may be boosting that pet and that we determine that it's worth it. Other times it's the convenience of it, and I don't mean like, oh, what's convenient for us people, but more like, is it something that is really hard to get into our pet, in which case we might want to weigh our options and say, is this really worth it? If it's an animal that has a really hard time with appetite, we're going to be very careful about what we put in the food, if anything, and so that's going to change how we're going to approach things. We might want to do things that are more topical or physical treatments for a pet like that, like acupuncture or physical therapy, massage, tuina. But if it's something where it's a goofy Labrador retriever like mine sitting at my feet right here who will eat anything in his bowl, then I'm not going to be as concerned about that. But an elderly old cat, I certainly am. So the next question is sourcing. So if you have looked around the World Wide Web, you will find that there are 1 million different companies that are offering herbal medicines. And that is really great in many ways and really problematic in other ways, because it's very important that we have responsible companies doing these, creating these supplements, and it's really important for us all to be aware of where the pitfalls can be. So first of all, I would recommend working with your veterinary team and knowing which ones that they are comfortable and familiar with in terms of supplements. I think a good area of this would be glucosamine and chondroitin. Most of us vets have our favorites. Most of our veterinary nurses also have our favorites and can tell you the pros and cons. Maybe this one is a little bit more palatable for most dogs. This one seems like a treat. This one is an injection and might do better for those who can't do the pills as frequently. So that can be really helpful. When you look on at a company's website, it should be very clear what their company is made of, where they're located, and how they are qualified to create these medicines. There should be transparency with what their level of experience is and how they come by their formula. You should be able to look up online reviews, though I would be cautious about reading too many of the testimonials, because sometimes those can be based on fact, and while they're sometimes really helpful, they can also be based on people's experience, so they may or may not be medically sound. The other thing is you want to make sure that you are purchasing a supplement not from a third party, so you want it to be directly from the company. So it's always going to be my preference for most of the supplements that I prescribe for them to be dispensed by us, because I know that I can guarantee if there's something that goes wrong, I can guarantee that I knew where it came from and I can go back to the company. If you purchase something online, you have to be very careful about who you're actually purchasing it from. If it is not the company itself, I would steer away from that. And I would, in most cases, steer away from companies that are not recommended to you by your healthcare provider. But if it's something that they have cleared and said, like, yes, I think this is a good idea, or no, I have no objections to it, then just make sure you get it from the company itself. Sourcing of materials. So a lot of herbal combinations are historical in origin, so they've been around for a long time, and we have different standards and different practices for what is environmentally friendly and what is ethically sourced. So we don't want to get anything from endangered species. We don't want to get anything that is going to harm like people's livelihoods or their culture in that way. So that's really, it is good to see what the company's stance is on these things. A great example of a company that we use a lot is Standard Process. If you go on their website, they talk to you all about how they sustainably farm, organically farm, where they get all their ingredients when they can't grow them at their farm because it is in one part of the country in the USA, where they go to get it from, and how they secure it and everything. And that's a really good example of a company that does things very well, in my opinion. A lot of our herbal companies that we use at Sleepy Dog, and also Standard Process, who I was just discussing, they make their manufacturing processes in coordination with what the regulations are for the FDA, so that if at some point they need to pull a sample of a lot that they have created, they always have a thing to pull from, so they can do any research they need going forward. I think that's not true for a lot of companies, so that's another thing to really look into and make sure that you're comfortable with the way that they are processing. Another thing that can be very terrifying, in all honesty, is that when companies make substitutions, when they don't truly understand the combinations that they are creating, it can be dangerous and even lethal. So there are some herbal ingredients that are seem very similar, like maybe it's a different part of the same plant, but in an herbal remedy that can end up with a different function, or it could even be toxic. So that's why I tend to stick with the same companies that I know they know how to formulate, and they know how to source, so that I don't have to worry about that as much. But those are like some of the kind of scary things that you can hear about. So there's some of the dangers to consider. So faulty products. The other thing, making substitutions, like I just said, inappropriately, that affect the way the formula works or its safety. Other things include not choosing the right formula for your pet or the right product for your pet because of not working with someone who is evaluating the symptoms and evaluating your pet's physical status. So another good plug for bringing your pet in to your veterinary team. There's also something that I see a lot in my practice, which is too much of a good thing. So too many supplements. There are so many good things about so many different compounds out there, and we love our pets, so we want to give them all at once. And sometimes that can actually make their appetite poor. Sometimes they will become very suspicious of what is in the food. Sometimes all of those good things can be canceled out by each other. So it's really nice to be able to have someone who can help you prioritize. Like, this thing is the most important thing to get in. If our appetite is still great that day, then let's slip this thing in, or let's give this in a different form so that it is not such a trial for everyone involved. So that's just something that I definitely see a lot. I'm more of a minimalist when it comes to my supplements. I like to start one at a time. I like to ramp them up slowly so I know if there's going to be any side effects. And then I like to add on as many as seems reasonable and good, but not so many that it is really hard on the patient and their digestion in particular. There's also side effects. As we talked about, allergies can impact organ function, just like our conventional medicines. Our livers and our kidneys clear a lot of our drugs and our supplements. If there's something going on in one of those organs, we can push that organ over the edge and cause some trouble. So that is also the case. There's also certain medicines that shouldn't be used with different herbal supplements, and so that's really good to know about. There are some heart medicines that are really made, dangerous things can happen with heart herbals. So you always want to tell your veterinarian and your veterinary health team what you are using at home if they don't know. This is good advice for your people doctor as well. but nothing comes without a consequence. So you don't want to just add in herbal supplements that seem like an excellent idea without consulting to make sure that it is safe with medicines or other supplements that your pet is taking. All right, so a couple of examples. So let's say we had a arthritic animal who was on some anti-inflammatories that were really helping with the symptoms of arthritis. And at the last check of blood work, which should be done a couple times a year, if not more, there was a spike in those liver enzymes. So a good way to approach this would be to have your veterinarian, who would most likely recommend a standard dose of milk thistle and SAM-E. They would probably recommend a company called Nutramax, which has been around forever and is probably one of the first ones that most conventional one of the first companies that most conventional veterinarians were comfortable with. So Nutramax, that makes Denamarin. They would recommend putting the animal on the Denamarin, which is that combination of milk thistle and SAM-E, for a month. It's going to work the best taken on an empty stomach a half hour before food. So they would recommend to you that that's going to be the best way for it to work. And then recheck those liver values in another month. So if those liver values in another month looked like it was like things were improving, then we may try discontinuing the milk thistle and the SAM-E, or we may continue on them because they have some other benefits as well. SAM-E can actually help with joint pain. But if they didn't normalize, then we may want to search a little bit more in terms of what may be the cause. Maybe it wasn't just the nonsteroidal causing a little spike in those liver enzymes. Maybe there's something else brewing in the liver, and that's going to get us the most information and be the safest way to approach something like this. The other reason I love this example is this happens all the time in conventional medicine, so it's a great example of how herbal medicine is starting to sneak its way into conventional medicine. So another example would be something that I get asked about all the time. So my pet has pain, and I have read on the internet that turmeric is really helpful in inflammation and pain. And that may absolutely be true. I love turmeric. I think it is great. It would depend, however, if it was appropriate based on what the pet looks like. So if the dog or cat is looking for heat in the house, is often really hot. If the pet is looking for cool places in the house, is very hot, and sometimes has a tendency towards nausea, then turmeric might not be a good fit for that pet. Even though it has great properties, it may be better for that pet to have a more cooling herb that would also reduce inflammation, but do it in another way that is going to be better for its digestion. However, if you had a dog or a cat who was seeking heat and had very strong and robust digestion, also pretty painful, also inflamed, then you may in fact want to do something with turmeric in it, because it would be nice and warming, and that pet digestively might jive with that a little bit better. So that might be the case that something like standard process Boswellia complex might be a good fit. Boswellia complex has a couple other herbs in there that are really nice, but is really good for certain animals of a certain symptomatic makeup. Hopefully that makes sense. So those are some examples of how we want to be very cautious with herbal medicine, but how they can be really helpful. And if people have questions on that, I am happy to go over that more. I also said that I would give an update on how Sleepy Dog was doing and how we were doing everything these days. Everything is going along COVID fine, as I would say. So on the relative scale of how things are going, we're okay. We are still limited to our curbside service, so we can only see one patient an hour. And the reason that is because of all the cleaning and to reduce social contact and promote social distancing. So patients do need to come in the building by themselves, and I know that's a real bummer, but it is the safest thing for everyone involved. We also have two teams going right now. So we have myself and Nurse Sam are one team, and Dr. Jenny and Nurse Emily are another team. And we try to keep things separate so that should anyone become affected by COVID, we do not have to lose all of our services and our whole team. We also have our remote support teams, so we have those guys at home. Emily also does work on the remote team. Marlena is also there, and Mish is also there, so you may hear from them. So they are working out of their homes to stay safe, but they have contact with us by phone and internet and Slack and Zoom and all that stuff. So they are also helping. We have contactless payment. So our support squad at home helps us with that. And we can do scheduling and all that stuff remotely. It is the case that Lori, our grief counselor, is also doing remote grief counseling. Chris, our physical therapist, is doing home call physical therapy outside to keep people safe. And Jenna, who is our veterinary social worker, is helping us virtually as well. So it looks like we are probably going to be doing our curbside service through the fall based on what I'm reading across veterinary medicine, but we will keep you posted on that. Because we have a limited number of appointments, if you have a particular time or timeline that you would like to get in, please make appointments as far in advance as is possible, because it is something that really helps us to make sure that we can see everyone when they need to be seen. The other thing is we have been doing our client intake or client histories virtually. So when you get your reminder for your appointment, someone will send you one of our remote support squad members will send you a questionnaire, and it really helps us if you fill that out because we get a lot of information. It looks like we send you the same questions every time because we do, but things often change and we pick up those changes on those questionnaires. So please help us by filling those out in advance of your appointment. We also have our pharmacy has exploded in this times in terms of what we're able to dispense to try to keep the trips to the pharmacy or pharmacies around the world less. So we have curbside pickup for our pharmacy items as well. I would say that we have had a little theft, so we now have a lockbox system out there that you will see. There's now a bench out there that we can do secure pickups. And I just want to particularly express my gratitude for all my wonderful clients, all our wonderful patients that we get to see on a regular or as needed basis. I appreciate all of your patience, and I appreciate all the love that you give to your pets and our team. And as always, if there's any topics that you'd like for us to discuss on Facebook Live, we're happy to have any of that feedback or any demonstrations that you would like to see in the clinic. I have heard that I need to get a microphone when we do our demonstrations, so I will work on that so it'll be clear under all that PPE. And with that, I hope you guys all, wherever you are in the world, enjoy this day and stay safe and stay happy. Thank you.